PACE is one of the best kept secrets in healthcare. A lot of people don't know what it is, or there are other programs that go by the name PACE. We are the program of all-inclusive care for the elderly, which is what PACE stands for.
Welcome back to another episode of the Elder Care Insights podcast by Welcome Back Home Care. And today we're honored to have a very special guest, Georgia Kornblatt, who helps run a PACE program. And Georgia, will you please introduce yourself and how long have you been doing this PACE program for? How'd you get into this side of the business?
Good morning, Lee. Thank you so much for having me. It's a real honor to be here. Let me explain a little bit about PACE very briefly. It's a long-term care program for seniors who want to be able to remain in their own homes and avoid nursing home placement. And I got started in PACE back in 2001, working actually as a PACE surveyor for the Department of Public Welfare in Pennsylvania, and did that for a few years and then switched over to the provider side. And I've had the honor of working with 3 different PACE programs before I came to Kinship Health, where we're working to establish ourselves as a PACE provider in Florida.
Okay, sounds very good.
Very
So I'm with the National Age in Place Council. We have some of the similar goals. We have a nurse registry. At one point, we said we're the alternative to a nursing home. Now we just sometimes work in the nursing homes by supplementing the care. So it's a very great goal that the PACE program has. And thanks for kind of bringing some general information to the public. So how is it that the PACE program helps seniors remain in their home?
So PACE is a program designed for seniors 55 and older and those who are eligible for nursing home placement according to the state. So they have to have some level of ADL deficit, usually, bathing or dressing, maybe walking, and qualify then for long-term care placement in a nursing home. But clearly they want to remain in the community, whether they're living at home independently with a relative or perhaps in an assisted living facility, but really want to avoid having to go to that next level of nursing home placement. So PACE is designed around an 11-person interdisciplinary team who focuses on each participant. They're small programs generally. We're not talking about Medicare Advantage programs who serve hundreds of thousands. We'll serve, hundreds to the low thousands in some cases as the program grows. But in the beginning, it's almost a one-on-one situation when we're first enrolling our participants. So the 11-person interdisciplinary team is comprised of the person's primary care physician, nurses, dietitians, social worker, transportation, home care, personal care, and physical and occupational therapy. So it's a whole team that wraps their arms around the participant and manages their care from soup to nuts. So anything that the participant needs, PACE will provide, from in-home care, transportation, durable medical equipment, prescription drugs, and specialty physician services, and even emergency and inpatient hospital stays.
This sounds a little bit like care management. Is there a cost to this PACE program?
So that's the wonderful thing. If an individual is eligible for medical assistance or Medicaid, the cost is $0. They will never pay a penny unless they're placed in a nursing home for the long term.
So PACE is a program that's connected with the Medicaid?
Right. It's duly sponsored by Medicare and Medicaid. So how it works is we're what's called a capitated program. So each month for each participant, we get a payment from Medicare if they're eligible for Medicare, and a payment from Medicaid if they're eligible for Medicaid. And that money all goes into a large pot. And with that those funds, we need to care for all of our participants and provide all their care and services. So we're actually incentivized to keep our participants healthy and well, give them the low-cost home and community-based services, um, you know, and additional therapies. We're not restricted by Medicare timeframes for therapy. They can have as much therapy as they need to keep them walking or functioning well. And we want to give them as much primary care and even specialty care services that they need to keep them healthy and out of the hospital.
Yeah, that sounds good. From my understanding, Medicare is something that's until you get until the recovery happens, or the alternative would be long-term care, or you should be in a care community or a skilled nursing or a So Medicare wants you to show that you're making progress, show that you're on the road to recovery. But with this PACE program, you don't necessarily have to recover. You can continue using the services.
That's correct. So our goal is to maintain generally. We're not we're not looking to, make great strides in improvement in care, or excuse me, in improvement in function, though that generally happens, at least initially. But then our goal is to just maintain the individual at their functional level and keep them healthy and well.
That sounds good. Now, there's other PACE programs out there. Has Kinship Health, have we launched this program yet, or is it still in the works?
So we're still in the works. We are developing a 20,000 square foot facility that'll be located on Davie Road in Davie, and we're slated to open late fall, early winter this year.
Okay. So it's a kind of a combination. It can be in-home. It can be this big care community, which is going to comprise of, if I were to guess, some skilled nursing or maybe adult daycare. Maybe it could be a big type of almost like other communities that have multifunctional purposes where you can tap into some of those Medicare dollars by using this huge 20,000 square foot community in Davie. What are some of those programs that you're planning to roll out end of winter,
Sure.
maybe
So
2025?
yes, so the 20,000 square foot facility, I should have been more specific, is actually an adult daycare center.
Oh,
And so participants can come to the center anywhere from 1 to 5 days a week is our preference. They don't have to come to the center other than perhaps twice a year to be evaluated by their full team. But we prefer them to come to the center because it helps reduce social isolation. They can engage with their peers. They can participate in recreational activities at the center, even, trips out to the dollar store or perhaps the casino, wherever the recreation therapist is planned trips to. They can receive a hot meal at lunchtime, which may be, one of the few hot meals that they get, or, at least something prepared for them. And they can see our primary care provider, who will be located right at that adult daycare center. They can also receive their physical and occupational therapy at that adult day center and see other members of their interdisciplinary team.
so is this a Medicaid or Medicare? This is all either Medicaid or Medicare. Does adult daycare cover both of those cover for adult daycare?
Yes. Yes. So as long as you're a participant in our program, all of those services are covered.
Mhm. So this is really appealing to some of my clients. Although we're in the private sector, we still have folks and their families that call us and they say, do you have a attorney that can help me with Medicaid planning? We're in the process of this. So when people do that, and we refer probably once every, couple months, or even outside constituents, people in the community that decide not to go with private, but we help facilitate that referral to get them the proper legal to make sure that they're doing everything correctly to properly apply for Medicaid. So when that happens, we can easily give a suggestion hey, have you thought about the PACE program? You're located. So that's one thing. Now, can you tell me, I know Kinship Health, that's a big name. Is that state of Florida or is that national? How big
So
is Kinship?
we're a national medical services organization. We provide some consulting services and things of that nature, but we are in the process of establishing ourselves as a PACE provider in actually 5 different states currently across the country, and Florida being one of the primary states. We have 3 or 4 different locations in Florida under development, but Broward County will be our first site in Florida.
Okay. So can you, I don't want to put you on the spot, but can you name a couple other of those states? Because this is a national podcast. We have listeners through the nation just listening, and that's why we always want to kind of tap into some of those folks that are listening. And if they don't know about the PACE, this is great. But even if they're interested in using the PACE program, this may be a great resource.
Absolutely. Kinship Health is going into Indiana, Illinois, and the city of Chicago, Arkansas, Washington State, and Kentucky. For everybody's information, there are over 150 PACE programs across 32 states. So I definitely encourage anyone listening to this podcast to go to NPA, as in National PACE Association online.org. That's our affiliate company that represents PACE programs across the country, and they can help you find a PACE program in your area.
Great. And I do have nurse agency colleagues, home care CEOs in all of those states. And I understand that that's a very important market because the people I'm talking about are private duty home care agency owners. It's kind of a luxury market, but we do want to help. We're all good people in this home care mastermind forum, but we try to help as many. We never want to say no. We always want to say yes. Can you help me? Yes, we can. That's the goal. Although you're not going to work directly with us, yes, we're going to refer you to this person or try to keep you safe by providing this resource, whether it's durable medical equipment to keep the house safe, a home safety assessment, even those personal living alerts, the life alerts are very good to be a little bit proactive. I mean, because we understand it's not a perfect world. So my company's not for everybody, but I want to help those people. I want to try to help people. And now, at least when there's someone who talks to me about Medicaid and maybe they're talking about isolation, are there some triggers that may be a good call to action for reaching out to that npaonline.com or reaching out to you, Georgia? What kind of are they, like the telltale signs that somebody would be either eligible for Medicaid, needs PACE management, the PACE program, or, do you offer a consultation for people?
Oh, absolutely. We accept referrals from any resource, whether it comes from the individual, a family caregiver, an agency like yours, Lee, or a hospital. For example, we'll take referrals from anywhere. We will assist everybody with looking at their finances and helping them try to qualify for medical assistance. And a lot of people who think they may not qualify actually will qualify for medical assistance. So it's definitely worth looking into, regardless of your income and assets. And then, I'm sorry, I lost my train of thought.
That's
What
okay.
was the other piece of that question?
Sometimes I do the shotgun approach where it's like, oh wow, look at all these different questions. That's okay. We're talking about when you're talking about the medical assistance there. Are you talking about other things other than Medicaid?
No, that would just be Medicaid.
Okay. Yeah. It's really amazing to have these other resources, and I'm honored to have you as a guest, Georgia, because how many people can we possibly help? And this is a whole demographic, especially in Broward County. I'm sure that's why you targeted that county, because we know the high number and demographic of senior citizens, and also unfortunately, those senior citizens are among some of our lower financially sound people in Broward. It just happens in Broward County. That's the way it is. So there's tons of seniors that probably are eligible for Medicaid that don't know about it. And just, older adults who haven't had any idea about the cost of long-term care costs.
Right. It can get very expensive very quickly when you're trying to pay for long-term care services on your own, or even just acute care services, depending on your Medicare benefits. It can be very expensive, and PACE helps defray those costs, especially for those who are eligible for medical assistance. I did remember what you asked me as well, Lee, as far as how to identify when somebody's ready for a PACE program. So we're looking for individuals who maybe are having a little more trouble keeping themselves at home. Maybe they're having trouble walking or dressing or bathing on their own, having more trouble getting around, managing their medications. Maybe they have frequent falls or frequent visits to the emergency department. We're all about keeping people out of the emergency department, out of the hospital, keep them from falling. We do provide those personal emergency response units. So if somebody would fall or feel ill, they can just at the push of a button get assistance. We also offer 24/7 nursing support and physician services as needed.
And is there also a behavioral health aspect of it all? If someone feels that, sometimes when we come under hard times, or if there's a traumatic episode, that someone can call the PACE support number and talk about it.
Yes, absolutely. So our nurses are on call 24/7 and are there to assist the participant with whatever they need. And it might be, just calming someone down and suggesting they come into the day center the following day, even if it's not a day for them to come, or setting up additional home care for someone to come out and assist them during the day, whatever that might be. Or it may be a trip to the emergency department if they're feeling suicidal or something along those lines. But we do provide behavioral health services, whether that's through a licensed social worker or a psychiatrist. We'll have a network of care providers that they can choose from.
And so these funds for this program, is this a combination of privately and publicly funds?
It's all Medicare and Medicaid dollars. If someone does not qualify for medical assistance or Medicaid, they can pay privately for the program, but I will say it is several $1,000s a month. It is cheaper than a nursing home, which runs into the tens of thousands of dollars a month. But it is still costly. And usually if someone's private paying for our services, they're doing a spend down to spend down their assets. So they do qualify for medical assistance eventually.
Yeah, that makes sense. So do you know who was the pioneer of the PACE program? I understand Morse Life had started one years ago.
So the PACE program actually was developed in the early 70s in San Francisco. It was the brainchild of a woman named Mary Louise Ansack, who was a social worker with the Chinese American community in San Francisco. And they developed this program and got a very small grant to start it and give it a try. That eventually led to a full Medicare demonstration project where 10 sites were opened across the country in larger cities. And the program was tested over a number of years, and eventually it became a permanent provider status under Medicare. And then what happens is each state has to elect to have PACE as a Medicaid option as well. And once they do that, then PACE programs can open in that state.
Yeah, that sounds really amazing that this has clearly the benefits outweigh the cost, or else it wouldn't really be something that was available. And, you know, these are the people in their golden years. They deserve the best, no matter what, no matter how much they have. So I really admire the PACE program, what it's all about. So right now, Kindred Health, I've seen. Is there also Kindred? Are you affiliated with Kindred Hospitals?
No, we're kinship.
Kinship. Okay, Kinship. Okay. Thanks for clarifying. So where can we find Kinship Health? Is there a website that we can look
So
you up at?
there is a website for Kinship Health. You just need to search Kinship Health, but I will say it's under development. There's not a whole lot on there. Once we are active as a Medicare or Medicaid provider, then we will have a full website with information for how to make referrals and all the information you would want on the PACE program.
Sure, sure. And I'm sure you're working with a lot of companies that are worked with the Medicaid managed plans, community care plans, and working in conjunction with even private companies that accept the Medicaid managed plans. And, I can see a lot of collaboration with the PACE program, with the community at large, and just working together with the providers. I mean, we met at the Broward Coalition on Aging, where Welcome Back Home Care is now a corporate sponsor, a yearly sponsor. And I see that you were working hard to get the name out there, and, just talking about PACE and meeting so many people in the community, being very, very resourceful. Is that part of your day to day? Is that you're meeting people every day and letting them know about this future program that's going to be opening to help, the constituents of the community, and different providers? What's your average day like, working with Kinship Health?
So I have a very diverse role right now. I am the regional program director for Florida. So that is a big part of what I do. As you said, Lee, I work to meet with local community care providers, whether that's nursing home agencies or other providers like dentists or behavioral health providers, working to build our network and as well as get our name out there and let people know about PACE. PACE is one of the best kept secrets in healthcare. A lot of people don't know what it is, or there are other programs that go by the name PACE. We are the program of all inclusive care for the elderly, which is what PACE stands for.
Mm.
And we're not transportation, we're not anything else. We're the program of all inclusive care for the elderly. So getting our name out there, getting PACE's information out there is really a huge part of my job. I'm also working with Kinship in several other states to help develop PACE. So that's been an exciting part of my role.
Yeah, that's some good information, Georgia. All inclusive, right? I love that word
Yes.
inclusive, because it's a great word.
Yeah.
When I'm doing anything, I like to be inclusive. I always like to invite people to participate in some of the acts or whatever I'm up to, volunteering or, you know, even playing volleyball. Like, yeah, let's be inclusive here. So
Right.
let's include everybody and include all of these resources. So that's really serious stuff there. I mean, I'm out here every day, although my thing is I keep a very small lane, right? Like private duty. That's it. We're not claiming to do anything else. I've brought guests on who do everything else. But the guests that I have on the podcast are people that I refer to on a weekly, on a monthly, because when clients call me or call the office, we need to be that all inclusive company that's going to say yes. Our goal is to be the most resourceful, recognized and recommended company in Florida. So to be resourceful is part in part why I'm in these elder service resource network who, now I'm on the board of ESRN, and that's a tri-county. I'm happy to have you as a guest there anytime. And the BCOA, the Broward Coalition on Aging, involved in different networking opportunities. So I know the elder care attorneys, and we know the durable medical equipment people, and the third durable DME, the company in Broward, in Palm Beach. We need to have the diversification of resources and who they are, making sure that they're the top best companies that provide the best service possible, but also in the location wise that we have someone in Broward County South, we have someone in North Broward County, we have someone in South Palm Beach County, North Palm Beach County, because the community doesn't want to travel 50 miles to get a grab bar installed, or the DME specialist isn't really going to come out 100 miles, and their Broward County is such a big location. So
Yes.
yeah, I kudos to you. How do you, and maybe I can learn from this, how do you manage your schedule, and with being so busy, how do you pick and choose your spots where you're going to go to, and how you're going to educate the dentists, the doctors? Is it just kind of a sniper approach? You kind of just pick and choose your points wisely, instead of that whole shotgun approach where it's like, oh, a little bit of everywhere. You kind of target different, I guess, areas or networking groups. How do you get
Yes,
the word out there?
I have been targeting networking groups. I'm actually a member of BCOA as well as ESRN. So it's been great to
Right.
get out to those meetings and meet with different senior care providers across the counties. We only serve Broward County, but it's nice to make connections, and you never know who's going to send you a referral. If someone from Broward calls a Palm Beach provider, they may say, well, I can't help you, but I know somebody who can. So getting our name out, getting the word out about PACE is the goal, regardless of the provider. And so I have been taking a targeted approach there. We're also members of the Davie Cooper City Chamber of Commerce, as well as the Greater Hollywood Chamber of Commerce.
Very good. Very good. Are you working with any politicians, or trying to get,
Not current.
yeah.
I've been trying to get in touch with our representative for the Broward County in the Davie area, but have not been in touch as of yet.
Yeah, anything I can do. I'm trying to get more influential leaders on the podcast to talk about how they're helping senior citizens. So I think that we're kind of on the same page, and I believe that we can help each other by cross referring. And I'm not looking for anything in particularly. I'm helping to grow the word about PACE, and just to have more resources and more options for my clients and their families. I've noticed that when we don't really want to ask for much. We just want to give as much as we can. In 10 years, that has paid dividends. Like, I'm just so honored to have this great company, and in such a great location. I grew up in Coral Springs. I went to high school, middle school, elementary, learned to walk and talk in South Florida, and just to serve and give back, and to get this word out here. I'm doing my job, and you're doing a great job on your end. So how long has it been on this PACE? Are you on PACE with this PACE program? How long's it been?
Yeah, we are on pace. We had a little snag with going through the building permitting process. So it took us a little bit longer to get our construction going,
Mm.
but our center is well underway and should be completed by the end of June. And then we'll fit it out with all of our equipment and supplies and furniture, and get our adult daycare license. And then we have a final review by ACA, which unfortunately can take some time. So we're prepared for some delays there, but we're right on track and eager to serve the seniors of Broward County.
Hmm. Yeah, and so the whole program, the whole curriculum is pretty laid out there, and you have your whole operations manual and understand everything based on the education, the resource support, and all that. Now we're just waiting on some permitting, red tape kind of stuff. ACA takes a long
Yep.
time, Department of Health, whatever it is, all takes zoning and that stuff. And patience is a virtue. It will all work out well. I mean, you have such a great team. How many other people are involved in this operation here in South Florida?
So it is me, myself, and I currently.
Wow, three
As
people.
we get a
Okay.
little,
No, I'm
yes,
kidding.
as we get
That is a
closer to
lot.
opening, we'll be bringing on center manager, all of our interdisciplinary team, drivers, personal care assistants, perhaps some housekeepers. So we'll have plenty of jobs available through our program, and as we grow, we'll have more and more. It's a very high ratio of staff to participants. So we have a lot of staff for a lot of participants.
Yeah, let's look back a little bit on the economical impact, the societal impact on these programs. I'm sure there's been some studies, there's got to be hundreds of jobs that are,
Mhm.
being put together, whether it's the construction, municipality work, all these licensing, I mean, that's great for the economy, just people, moving, people working, and look at the societal impact. How many families are we saving by taking that worry away? And by saving, I mean, we're drowning in worry. At least we have some clarity and peace of mind. Maybe the water's up to here now. We felt like we're like can barely breathe here. I don't know, mom. What's going on with mom? What's going on with dad? They don't seem right. Especially when they're so far away. We work a lot with care management, and a lot of the times it is the adult children that are either far away, or you hear about the adult children who say, I can't do this anymore. I can't live with myself like this.
Right.
I want to be the daughter. I don't want to be the caregiver anymore. This is too much. I think that would be a call to action.
Absolutely. We're here to serve not only the participants, but their families as well. And we do provide a significant level of peace of mind, knowing that mom has somebody watching out for her when I'm so far away, or mom has somewhere to go during the day when I have to go to work and I don't have to leave her at home by herself. So it's a real relief for families and caregivers. We can also provide things like respite for families and caregivers, whether that would be over a weekend or maybe a week or so, put the senior into a long-term care bed just to keep that 24-hour supervision on them as needed. And then they would go back home after just a short stay.
That's really good. So the key to any relationship is communication. So we need to listen. And it seems that part of that 11-person team are a lot of good listeners there. And does the team with PACE, do they co-communicate? Are they cross-communicating with each other? Like on
Oh,
a,
absolutely.
there's a structure to this?
Yes, every morning the team sits down together around a table, whether virtually or in person, and reviews all the care and services that are going on for our participants, whether someone in the hospital, did someone go to the emergency department, did someone have a fall, who's coming into the day center today, who needs to be seen in the clinic. And then throughout the day, there's communication amongst team members. And it's not just the professional members of the team, our drivers and personal care assistants are our eyes and ears in the community. So if a driver is assisting, say, Mrs. Smith to the day center for her regular scheduled visit, he might notice today she's not walking as well. She's taking a lot of breaks and breathing a little heavier. What he can do is let the nurse in the clinic know that Mrs. Smith is not feeling well. She might not say anything because, unfortunately, that's what a lot of older folks do. They just kind of grin and bear their symptoms. But he or she may be going into a COPD exacerbation or congestive heart failure. And we can pick up on that very early and provide services in our clinic to prevent them from having to go into the hospital.
Yeah, that's great. Just inform the team of these common sense approaches. We don't have to be doctors to, and doctors do use common
Exactly right.
sense, so if we see something different, and that's how I talk to my caregivers a little bit, or, the caregivers, that if they see something, they need to report that to their client. They need to go ahead and say something, indicate, because it could be something that is underneath, beneath the surface, that's happening. And the body warns us, and the pain is a trigger. These warning signs can help uncover some things that we can't see. It could be internally. So if they're not being if they're not if they're not drinking, or if they're not drinking enough water, and maybe they notice there's patterns. We're all, as humans, we have patterns a lot of times. And so if something deviates from the regular, there's any abnormalities, if Mrs. Jones didn't use the bathroom that day, or, didn't eat lunch, you see the primary doctor says, you lost or you gained, a fair amount of weight. What's going on? I mean,
Right.
a
And
loss of weight can be a big deal. Also, gaining weight can be a big deal.
sure. And that's where PACE is so great, because we get to know the participants so well that we can pick up on those small changes very early on and notice when something is different, and intervene early on.
And that's nice, because you are taking that responsibility. That's part of the whole package, is that you have this team here that is going to follow up on all the communication. I'm sure that you kind of go towards that the primary emergency contact, talk to the family,
Mhm.
like you said. So
Constant communication. Yeah.
it's very much reminds me of a very good care management service, from even doing the financial feasibility studies, or checking out with the bills to make sure that this is appropriate. Maybe having somebody take over, making sure that they have power of attorney lined up, that they have all of these things in place. PACE helps kind of put those all together. Is that right?
Yes, we can help refer them out to elder law attorneys as needed for more significant things like guardianship and powers of attorney. We can also assist them with things like do not resuscitate orders to make sure that they are receiving the services that they want should they have a serious medical condition.
All right. Well, thank you, Georgia. I think we got into a good, pretty good scope of the PACE program. I appreciate you educating us on all of this. So, you the best day ever as a person working in the healthcare field. Why do you do it? And what is your best day ever in the healthcare field?
That's a great question, Lee. I've been a registered nurse for 24 years, and so I've worked in a variety of roles and care settings, either providing care directly or providing care indirectly as a facility administrator. And my best day ever is just when I get to see the individuals I'm working with feel well and healthy and happy and succeeding every day.
Well, I have the chills, so that means it was a good podcast. You can only I don't really know what it means, but I have a good feeling about this. So I want to say thank you. That's lovely, and thanks for all the support that you give the community. I do believe in the PACE program, so call me, guys. Talk to me. You know where to find me. Just if you have any questions about this PACE program, you also have a great resource right here at npaonline.com. Reach out to Georgia Kornblatt, who's building this wonderful PACE program in Broward County, Florida, and beyond. So call us if you have any questions about what is involved in this PACE program, where are these PACE programs heading, and just call us and reach out to us, and we'll definitely help you and inform you how to tap into this PACE program. Are you eligible? Well, everybody's eligible because it's all inclusive. So just call us and we'll help out. And, thanks for all that you do. It's been a pleasure speaking with you here on the
You
Elder
as well,
Care
Lee.
Insights. So thank you to my loyal listeners listening in. And I really hope that you learned a lot more on this episode. I really know that you did. Please stay tuned, like, subscribe, find me on LinkedIn. The next couple episodes we already have in the calendar. We have an expert on hospice coming up. We have an expert on Medicare coming up. So stay tuned with us. And thanks for all your great comments, for liking, because they really mean a lot to me. Let's stay engaged because we're doing this for you. And thank you to everybody in the community, in the healthcare communities, for all the constituents you serve. And we look forward to seeing you next time on the Elder Care Insights podcast. Thank you, Georgia Kornblatt with Kinship Health. And thanks for putting on this PACE program.